time has come for us together to work on how to address this very significant problem of non-communicable diseases causing chronic illness at an increasing rate around the globe. How can we work together to try to identify interventions that work and to stem the tide of what otherwise will be very substantial incidence and prevalence of disorders which cause untold human suffering and premature death.
UCL's unique spin, I think, is it's the way the disciplines can work together. UCL is the largest multi-faculty university in the UK. It's the largest biomedical university in the UK. But unlike some of the other specialist institutes, we can bring economists, anthropologists, geographers, engineers, mathematicians to the party. So when you're thinking about, for example, high blood pressure or strokes, we know that's related to obesity, which we know is related to lack of physical activity, which we know is related to urban planning, which is related to economic opportunity. You see, it's a very multi-dimensional problem.
The GACD is an alliance of publicly funded research organizations from around the world. And our focus is on priority areas of chronic disease research in low and middle income countries. Ironically, as we see countries developing and as we see economies become more successful, the diseases that sort of come with this development are the chronic diseases, and therefore now what we see is that 80% of the deaths in the world attributable to chronic and non-communicable diseases happen in low and middle income countries. Success to me would look like a strong collaboration across national funders of medical research, where knowledge is shared across boundaries, where a healthy community of researchers is developed, where young people interested in the field of non-communicable diseases research can look to the GACD as a resource to ask good and important questions, to find other researchers to work with, and also to suggest and make recommendations as to how we can innovatively and creatively address the diseases beyond the medical and health fields.